Hello and welcome to this tutorial. This is the tutorial for the management of schizophrenia. So the instruction for the candidate is you're about to see the mom of the young gentleman who was diagnosed with schizophrenia. She wants to know more about his diagnosis and management. She is upset because she has been told by the nurses that he has schizophrenia. She appears quite anxious and distressed. The task for the candidate is to explain to her more about her son's diagnosis and management and to address her views, concerns and expectations. The bullet points, candidates, which I would like you to keep in mind and to jot down are the following 6 factors. First and foremostly, you want to explain to her more about the diagnosis of schizophrenia. Thereafter, you want to explain what the signs and symptoms are. Thirdly, you want to explain what the management is in terms of a biological, psychological and social approach. Fourthly, you want to highlight the need for compliance. Fifth, you could give some more information on prognosis. And the 6th point would be talking about the multidisciplinary team involvement in her son's care. So in this tutorial, we will go through each bullet point step by step. The key communication skills required in this station is important. The scenario usually you are faced with is with a mother who could possibly be standing up, as I know this is a case I had in my exam. She's quite distressed and anxious, and she's angry at the same time. She's been told that her son has schizophrenia, and she has a lot of guilt feelings around this. She doesn't believe he has schizophrenia, and she is upset that he now has this diagnosis. So the skills here are: 1, that you need to show some empathy and sensitivity to a mum who now is concerned about her son having been diagnosed with schizophrenia. In a sense, the way I look at it is as if you're thinking about someone who has a child who had hopes and dreams for their child, and now only to be told that her son has a mental illness. So it's about the guilt feelings, about her dreams being shattered, the anxieties around him having this diagnosis, and also the stigma. So it's a lot of emotions that you need to deal with, and you need to try to contain her anxieties. The second thing is, in a sense, this is like a station of breaking bad news, because that's what it is. You're going to impart some information to her which she doesn't want to hear, and is possibly in denial that her son was ill, and wants to attribute her son's illness to something like cannabis, which is usually the case in this scenario. So it's about tackling those 2 skills, which is 1, showing sensitivity and empathy, and 2, using your skills as if you were imparting information in a breaking bad news style or format. So the introduction that you would need to think about would be something like this. Hello, Mrs. Blake. I'm Dr. Muglia. I'm sorry to see that you are upset about your son. I've come to talk to you more about his diagnosis and management. Before I begin, may I ask what you've been told, and also find out how you think he's been over the past few weeks. Hopefully, you would have built some rapport with her. If not, you need to continually try and reassure her that you are there to talk to her, to listen to her concerns, views and expectations, and that you want to assure her that you are treating her son and ensuring that you have his best interests at heart, and thus sharing some common ground with her. Thereafter, you want to explain about what schizophrenia is. So schizophrenia is a serious mental illness. It affects 1 in 100 people and usually starts at the age of 15 to 35. What happens in schizophrenia is that it affects the way in which someone thinks, feels and behaves, and they can present with what we call delusions and hallucinations. Delusions are where their thinking becomes so fixed, where they can start believing that people are after them and become suspicious. And the hallucinations are when they might start seeing or hearing things that are not real. You could also then try and personalize this with using symptoms which her son has presented with. For example, you could say, like in your son's case, he had become increasingly suspicious about his college mates and believed that they were poisoning him, and he was also starting to hear some voices. The other symptoms that you might want to mention is that some people do present with other symptoms, which we call the negative symptoms, which they start isolating themselves and present with decreased motivation and reluctance to talk. Once you've given her the information about schizophrenia, she might want to know about what are the causes. There is no one particular cause for schizophrenia. What we do know is that it is hereditary and it can occur in families. So if there's a relative who has schizophrenia, there is a 50-50 chance that you can develop schizophrenia. The other causes to mention is that it can be caused by some winter birds, by stresses, and also by some illicit substances like cannabis. I think in this scenario, she feels that this is her fault, and you need to explain to her that in no way is this her fault that her son has schizophrenia. And this would be one of the ways in which you can tackle the anxieties and the distress that she's going through. Thereafter, you want to talk more about what the management would entail, and that is addressing the management in terms of the biological, psychological and social or holistic approach. The biological aspects of treatment would include medication. We have a group of medication called the antipsychotic medications, which helps for these thoughts that he could be presenting with, the delusions and the hallucinations, and it helps to calm someone down. You could mention the side effects of the medication. For example, they do cause some side effects. The older medications that we use usually cause some extrapyramidal side effects like stiffness of the joints and some Parkinson's-like symptoms. However, the newer medications has a lesser chance of causing this, and they can cause a dry mouth, some low blood pressure, and a raised prolactin level. Depending on which medication is being used, you will need to address that accordingly. For example, someone on olanzapine, it would cause more weight gain, impaired glucose tolerance as well. Once you've given her this information, you could then move on to smoothly to talk about the psychological and social aspects of treatment. The psychological aspects of treatment is that there could be some form of counseling in the longer term when he's more settled, also some psychoeducation for herself and the rest of the family, as this would ensure that all those involved in his care would be aware of what his symptoms are that he's presenting with and how they need to be managed. And thereafter, you could talk about the social aspects, which would involve supporting him and his family, and also thinking about getting him involved in vocational training and getting him back to doing some sort of either voluntary work or training courses, as he has been in college in the past. In terms of the prognosis, you want to highlight that it is difficult to predict how he would respond to medication, but what we do know is that we aim to try and get a person back to their normal state. We do know the rule of third is that a third of people will recover, a third will recover, however will continue to need medication, and a third will never recover and just continue to have chronic symptoms of schizophrenia. And at this point it's difficult to pinpoint in which category he would fall in. You would also then, at the last bullet point, is to talk about the involvement of the multidisciplinary team. And you could say that you work as part of a multidisciplinary team, which include not only psychiatrists or doctors, but there's social workers, nurses, occupational therapists, physiotherapists, vocational workers, and other therapists who also could assist in supporting both him and the family in his home setting once he's ready to be discharged home. Again, you would need to emphasize the need for compliance with medication, and that if he does not take medication, there is a chance that he could become ill in the next 6 months. In a nutshell, this is the station for the schizophrenia management station, and as you can see, it's a lot of information to give, and at the same time it's about obtaining a balance with managing a scenario where the mother is anxious, distressed, has a lot of guilt feelings, and somehow now feels that she's been given extremely bad news about her son having schizophrenia. So it's about managing the situation and imparting the information in bite-sized chunks. I hope this tutorial has been helpful. Thank you.